Chapter 26, the sensory system, the ear. The pinna of the ear collects sound waves and channels them into the auditory meatus. The hairs in the cerumen in the ear canal prevent foreign objects from reaching the tympanic membrane. And the tympanic membrane vibrates when sound waves hit, and the sound vibrations are conducted to the malleus. The bones in the middle ear transmit vibrations to the inner ear. The malleus transmits to the incus, and it transmits sound vibration into the stapes. The stapes transmit sound vibrations to the oval window, and the oval window transfers the motion to the fluid in the inner ear. The fluid motion in the inner ear will stimulate the sound receptors in the cochlea and the organ of Corti. The organ of Corti will transmit impulses to the cochlear branch of the vestibular nerve, which is cranial nerve number 8. The nerve carries the impulses to the medulla oblongata, the thalamus, and then to the temporal lobe of the brain, which contains auditory cortex. The eustachian tubes help equalize the pressure in the middle ear. The receptors that are responsible for equilibrium are the inner ear. The impulses from equilibrium receptors are transmitted to the brain via the vestibular branch of the vestibular cochlear nerve, cranial nerve number 8. The cerebellum is important in mediating the sense of equilibrium and balance. There are many age-related changes within the ear. The cerumen will become harder and contain less moisture, and the backup may contribute to low-frequency range hearing loss. The tympanic membrane will lose elasticity. The joints between the auditory bones will become stiffer, and then the stiffness will interfere with the transmission of the sound waves. There are gradual loss of receptor cells in the organ of Corti after 40 years of age. The number of nerve fibers in the vestibular nerve decreases. This contributes to hearing loss and sometimes will affect the balance and the equilibrium. Loud noise is a major cause of the sensory neural hearing loss, and the use of headphones or earbuds contributes to determining hearing damage and maintaining hearing. Conductive hearing loss most often occurs from stiffening of the bones in the middle ear or from scarring of the tympanic membrane. Both types of hearing loss may be present, and this would be called mixed hearing loss. Conductive hearing loss most often happens from stiffening of the bones of the middle ear or from tympanic membrane scarring. A vast amount of hearing loss results from employment-related exposure to loud noise and continuous noise. Continued exposure to excessively high levels of sound can produce a sensory neural loss called noise-induced hearing impairment. Many medications can be toxic to the inner ear. Commonly administered medications that can be ototoxic are antibiotics, non-steroidal anti-inflammatory drugs or NSAIDs, chemotherapy agents, diuretics, aspirin, and other salicylates can produce a high loss of hearing frequencies and tinnitus. The older patient has a greater chance of ototoxicity because of the analgesic medications that they are taking due to chronic pain. Older adults' liver and kidneys have decreased function because of aging, so they are unable to degrade and eliminate drugs as easy as they are in young people. One simple hearing test that can be performed is the whisper test. The Weber test and the Rhine test can also be performed using a tuning fork to measure hearing by air conduction or by bone conduction. Nystagmus, which is an involuntary rhythmic jerking of the eyes. To check for that, hold a finger in front of the patient at eye level. Ask the patient to follow the finger with the eyes and not moving the head. Move the finger slowly from midline toward the right ear about 30 degrees and then back to midline and slowly toward the left ear. Watch the patient's eyes for any jerking movements. The Romberg test is a test of equilibrium. The patient will stand with their feet together and arms out to the sides and the eyes open. Note the ability to maintain an upright posture without swaying. This is a negative Romberg test. When a patient is severely hearing impaired, communication with that patient for treatments and activities of daily living will take longer because they don't hear as well. This needs to be taken into consideration when the nurse is creating their care plan for these individuals. If the patient doesn't have adequate aids to hear, devise an acceptable way of communication with this patient. Some simple ways to assist the patient in hearing you is to make sure that you're sitting at face level with the patient, speaking clearly and distinctly. It's not always a matter of how well or how loud the voice is. The patient needs to be able to hold your attention so they can read your lips and listen to you at the same time. If there's extraneous noise that can be controlled, it should be turned off to promote the patient hearing what you are saying. For optimal distance with hearing impaired, you should be roughly 2.5 to 4 feet away from that patient, face to face with that patient, and speaking clearly and distinctly. No smiling, chewing gum. They need to be able to hear what you have to say. We know that short, simple sentences promote better hearing and understanding with people that have hearing difficulties. We also know that we need to make sure that we give the patient appropriate time to respond. Sometimes they need to think about what is being said to them before they can promote an answer. If you're uncertain, it is best to ask them to repeat what you have said, or they could write what you have told them to make sure that the message has been conveyed appropriately. When communicating with a hearing impaired patient, the nurse must consider which strategy. Sit at eye level facing the patient, chew gum, enunciate clearly, speak directly into the patient's ear, use simple sentences. The answer is 1, 3, and 5. If the hearing aid doesn't work, first note if there is a battery in place and if it is turned on. Sometimes it could be as simple as it not being clean and there might be wax inside. Need to make sure that it fits appropriately and that the volume is adjusted for patient hearing. These are various types of hearing aid. Number 1 is a behind the ear style. 2 is completely in the ear canal. 3 is invisible in the ear canal. 4 is in the ear. 5 is in the ear. 6 is receiver in the ear style, RIC. Remember that hearing aids are extremely costly. So as a nurse, we want to make sure that our patients' hearing aids don't become lost, that they are cleaned appropriately, and that they are placed in a container with the patient's name on the container to make sure that they are kept in a safe place. Installation of ear medication. Sometimes eardrops will be prescribed to dissolve cerumen, relieve pain, or to fight infection in the auditory meatus. The patient should be positioned in the supine lateral position so that the affected ear is facing up. Medication should be at room temperature because cold eardrops may cause discomfort or dizziness. For adults and children 3 years of age and older, the ear canal is straightened by drawing the pinna up and toward the back of the head. For a child younger than 3, the pinna of the ear is pulled down and back to straighten the ear canal. Hearing aids assist some people with sensory neural hearing loss. These aids are designed to simplify some pitches and block out others that do not need amplification. Central hearing loss occurs in the brain as a result of a pathologic condition above the junction of cranial nerve 8 and the brainstem. Central hearing loss can result from a problem of transmission of stimuli in the brain, an inability to decode and sort signals received from one or both ears, or a failure in the transmission of sounds from one hemisphere to the other. The sense of balance and equilibrium is governed by the vestibular system in the inner ear. An increase in fluid pressure in the inner ear, inflammation, and vascular disorders can interrupt blood supply to the cochlea and produce dizziness, a loss of balance, and nausea and vomiting. Ringing or buzzing in the ear or other continuous noises can be mildly annoying or severe enough that it interferes with activities of daily living and may prevent the patient from getting adequate rest. The tinnitus may be intermittent or continuous. Continuous cases are routinely caused by an underlying medical problem. Common causes of tinnitus might include presbycusis, hearing loss associated with aging, constant exposure to loud environmental noise, inflammation and infection in the ear, otosclerosis, Meniere disease, and labyrinthitis. There are specific measures to help rehabilitate a patient that has hearing loss. It depends on the age and the aptitude of the patient. Adults that have acquired the skills of speech and language before their loss are better able to pick up on language cues and understand what is being said for them, and routinely have fewer problems with communication by language. Learning to lip read is difficult. It requires at least an average intelligence, exceptional language skills, excellent eyesight, and a lot of persistence and patience. Many individuals who are deaf learn to communicate with sign language. American Sign Language is the third most commonly used language in the United States. For external otitis, redness is evident on the otoscopic exam and there may be drainage. A severe infection may require oral antibiotics. Teaching patients to use drops of a drying solution in the ears after they have been exposed to water can help prevent external otitis. Sometimes irrigating of the external ear canal is necessary. Warm water is used to remove cerumen and debris from the canal. The water stream should be aimed above or below the impaction to allow the back pressure to push it out rather than further down the canal. The diagnosis of otitis media is based on otoscopic examination that shows redness and bulging of the eardrum or tympanic membrane, or it may show pus behind the tympanic membrane. Perforation may occur with the drainage of the pus. This relief in pressure usually resolves the pain and the pressure sensations. When the infection is sudden in onset and of short duration, it is called otitis, acute otitis media. The eardrum is retracted inward because of the negative pressure from a closed eustachian tube, and the pain can be quite severe. There is much controversy about using antimicrobial agents for otitis media because so many strains of pathogens are becoming antimicrobial resistant. 1/4 of the otitis media infections are viral and will resolve without treatment. For repeated episodes of otitis with fluid or when fluid will not reabsorb, a myringotomy is done. A myringotomy is an incision into the eardrum. Often a ventilating tube is inserted into the eardrum to drain the excess fluid in the middle ear and to equalize pressure while the eustachian tube is blocked. Labyrinthitis is most commonly occurs from a viral respiratory infection, but it can be also a complication of bacterial meningitis or chronic otitis media. Sensory neural hearing loss in the affected ear or tinnitus may be present. The treatment is aimed at treating the primary disease and controlling the symptoms. For Meniere's disease, if the symptoms occur as a result of the disease process, the condition is called Meniere syndrome. Meniere's disease occurs most commonly in females and most common in those between the ages of 40 to 60 years of age. The disorder is routinely unilateral, and there is no specific test for Meniere's disease. Diagnostic criteria are 2 spontaneous episodes of vertigo lasting at least 20 minutes, confirmation of sensory neural hearing loss by testing using audiometry, and tinnitus and/or a reported sensation of fullness in the ear. Any quick, sudden movement of the head or eyes during an attack will usually produce severe nausea and vomiting. The patient is kept quiet and in bed to avoid aggravating their symptoms. Acoustic neuroma is also known as vestibular schwannoma. The symptoms are an unsteady gait, facial numbness, vertigo, and taste disturbances. The tumor is routinely slow growing, and the symptoms are dependent on the structures that are affected by the tumor and the tumor size. Neuromas that are identified early on imaging studies without any clinical symptoms may be watched until the symptoms appear. Otosclerosis is a disease process that causes the formation of excess bone. Microsurgical intervention can restore air conductive hearing by providing a new movable pathway for sound waves. During the operation known as a stapedectomy, the stapes is removed and replaced with a prosthetic device. A tympanoplasty involves the surgical reconstruction of the tympanic membrane and ossicles to restore middle ear function. This is a cochlear implant drawing. This is an electronic device that is surgically implanted into the cochlea of a deaf person. The sounds transmitted are electronic and sound mechanical, but most patients adapt within 1 to 2 months. For an ear surgery dressing, the patient is positioned with the head of the bed elevated or lying on the unaffected side. Balance may be temporarily affected as a result of the disturbance to the mechanism that maintains the equilibrium. When the patient is allowed to get up and move around, assistance should be provided to prevent falls. Postoperatively, the nurse will instruct the patient to make sure that they do not sneeze, cough, or blow the nose because it can disrupt the surgical process. They should not drink through a straw. Avoid drinking from the mouth of a plastic bottle because of negative pressure. Limit physical activity for 1 week after surgery. Don't do any exercising or sports for 3 weeks. They should avoid heavy lifting for 3 weeks. Avoid bending over or moving the head for 3 weeks. Keep the ear dry for 4 to 6 weeks after surgery by placing a cotton ball covered with petroleum jelly in the ear canal when showering. After the initial dressing is removed, a cotton ball should be placed loosely in the ear to keep it dry and protected, and it should be changed as needed and at least daily. People that have had ear surgery should avoid people with colds and do not fly until it is permitted by the doctor. Hearing protectors should be worn when exposed to a loud environment, and return to work is usually permitted 3 to 7 days after surgery. Which instruction would be appropriate for a patient who has just had ear surgery? Cough or sneeze with the mouth open. Resume routine exercises. Avoid bending or heavy lifting. Keep the ear dry by plugging with cotton ball covered with petroleum jelly. Drink with a straw. The answers are 1, 3, and 4.